In this video, we're going to talk about AC joint injuries or acromioclavicular joint injuries of the shoulder. These are really common injuries. The AC joint or the acromioclavicular joint is the small joint between the end of your collarbone and the tip of your shoulder blade. It's not the ball and socket part of the shoulder, it's this small joint on the top of your shoulder. Typically, you injure this joint with a direct blow. So it may be in a sport like football, somebody tackles you or collides with you right on the outside of the shoulder and injures that joint. Or more commonly, you fall and get your shoulder driven into the ground. Not so much you land on your hand and it pulls you out to the side, but you land directly on your shoulder. So I see these in football or soccer players that get tackled or hit and they land directly on their shoulder. Or it may be somebody on their bike that crashes, flies over the handlebars, and land directly on the shoulder, and they injure that AC joint. Now, the severity of the injury can vary from essentially a mild sprain to a much more serious sort of separation. We used to call this a shoulder separation. So you may have no displacement at that AC joint, or you may have a big vertical separation because you tear the ligaments that hold that collarbone down. So you may see a lot of vertical separation in the more serious, type 3, 4, 5, 6 of those. Typically, and this is where seeing a doctor, especially a sports medicine orthopedic surgeon, is so important. The treatment really depends on the type of injury you have. Typically, types 1, 2, and 3 can be treated without surgery. Types 4, 5, and 6 usually need surgery to stabilize it, pull it back in place, and hold it in place with a variety of measures. Probably more complicated than is worth discussing here. The majority of them, though, can be treated without surgery. And it's a matter of getting the pain under control, so things like ice, maybe short periods of time with an anti-inflammatory, plus or minus use of a sling or a brace for a few days or maybe a week or two, and then start working with a physical therapy, getting shoulder motion back and getting strength of the muscles around the shoulder, like your rotator cuff muscles and really all the muscles around your upper back and your arm and your chest to really get the motion of normal activity mechanics back, get your strength back, take pressure off that area, and get you back to what you want to do. Return to exercise, return to sports really depends on when you have full motion, pain is gone, and you have the strength necessary to be able to do what it is in that sport. So that could be, a week or maybe 2 weeks for a mild injury, but that can be a lot longer for maybe a type 3, and obviously if it needs surgery, you're probably looking at 4 to 6 months. Sometimes it's important to know you may still have a bump there even after you've gotten your motion and strength back. That cosmetic deformity, so to speak, is usually not a problem. Patients don't typically like the visual appearance of it, but typically we don't talk about a really big surgery with lots of rehab and potential complications just for a cosmetic deformity. Again, if it's a serious separation, you're going to do a surgery to get that down anyway, but sometimes even the mild injuries can have a residual bump there that as orthopedic surgeons we typically leave alone. Okay, have you had an AC joint injury, a acromioclavicular joint injury, or what we used to call a shoulder separation? Describe the injury, how it happened, and how your doctor treated it, how long it took you to get back to sports and exercise. I'd love to read it, and I bet people all over the world would love to hear what you have to say as well. So below this video, describe that experience. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button on the upper right corner of the page. I record 2 to 3 videos every single week and they'll get delivered directly to you. Thank you so much for watching. I hope this was helpful and I look forward to seeing you right here next time.